For today's video, I will be showing you how to properly assess the peripheral vascular system of my patient. But before I start with that, let me introduce you the equipments that we are going to use in assessing the peripheral vascular system of my patient. First, we have here a centimeter, a stethoscope, a Doppler, also an ultrasound device, conductivity gel, a gauze or a tissue, waterproof or pen, and a blood pressure cuff. So as you can see, the equipments are complete. So now let's get started. So good afternoon, ma'am. So my name is Ana Rose Idolo from University of Eastern Philippines, and I'm your nurse student for today. So for verification, ma'am, may I know your name? Okay. What about your birthday? Okay, so ma'am, which language do you prefer to use? English or Tagalog? Okay, so ma'am, the purpose of this assessment is to identify any sign or symptoms of AVD, including the arterial insufficiency, venous insufficiency, or the lymphatic involvement. So this is accomplishment by performing an assessment first of the arms and the legs, concentrating on the skin color or the temperature, major pulse sites, and the major groups of the lymph nodes. So now, ma'am, I am going to sanitize my hands and I am going to close the curtain to provide you a privacy. So now, ma'am, I am going to ask you certain questions. So, ma'am, past history, have you noticed any color or temperature or texture that changes in your skin? What about do you experience any pain or cramping in your legs? Have you ever if you have a pain while walking, how far and how fast do you walk prior to the pain starting? So, do you experience heaviness and aching or the sensation in your legs by standing or sitting for the long period, like an edema or the do you have any sores or open wounds on your legs? So, ma'am, do you have any swelling in your legs or so, ma'am, do you have any swollen glands or lymph nodes? So, ma'am, in personal health history, can you please describe any problems you had in the past with the circulation in your arms and legs? So, ma'am, have you had any heart or blood vessel surgeries or treatments such as a coronary artery bypass grafting or repair of the aneurysm or the vein streaming? What about in family history? Do you or does your family have a history of DVT, diabetes, hypertension, or any elevated cholesterol? What about in lifestyle and health practices? Do you smoke or any do you smoke? So, ma'am, do you exercise regularly? So, ma'am, do you use a oral or transdermal kids? So, ma'am, have you experienced any stress in your life? Okay, so that's all. So now, ma'am, I am going to assess the peripheral vascular system. And I do need your full cooperation, so is it okay? So now I am going to. So now, ma'am, I am going to assess your arms. So first, I am going to inspect your arms from the size, presence of edema, and the venous sponge. So, ma'am, I observe that your arms are bilaterally symmetric with minimal variation in size and shape, and there is no edema or prominent venous patterning present. So next, ma'am, I am going to observe for the coloration of your hands and arms. Okay, so I observed, ma'am, that the color should be the same bilaterally. So next, ma'am, I am going to palpate your face ears and hands and arms, and I'll be looking for the temperature. So ma'am, we observe that your skin is warm with the touch bilaterally from the fingertips to the upper arm. So now ma'am, I am going to assess your capillary refill times. Okay, so ma'am, your capillary bed's refill color returns in 2 seconds, so it is normal. So next ma'am, I am going to palpate your radial pulse. So ma'am, your radial pulse is bilaterally strong, 2 glass and artery walls have a resilient vibe. So next, I'm going to palpate your ulnar pulse. Okay, so ma'am, your pulse may not be detectable. So ma'am, I am going to palpate your brachial pulse. Ma'am, we observe that your brachial pulse have a equal strength bilaterally. So now ma'am, I am going to palpate your epitrochlear lymph. So ma'am, I observe that your petechochlear lymph nodes are not palpable, so it is normal. So next ma'am, I am going to perform the Allen test. So I am going to put a pillow. Okay. Okay, so I'm going to remove the pillow. So ma'am, the pink coloration returns to the palms within 3 to 5 seconds with the ulnar artery. So the pink coloration returns within 3 to 5 seconds if the radial artery. So now ma'am, I am going to assess your leg. So I'm going to can you do it? Okay. So now ma'am, I am going to inspect bilaterally for the skin color. So I'm going to picture. Okay. So next I am going to inspect for the distribution of the hair. Okay, so I observe ma'am that the skin on the legs appears on the dorsal surface on the toes. So next I am going to inspect for the lesion or the ulcers. So I am going to note whether the margins are smooth and even location such as a pressure point, size, depth, drainage, or any other. Okay, so I observed that the legs are free from lesion or the ulceration. So next, I am going to inspect for the edema or the on the lateral or the bilateral. Okay, so I observed that the legs are free from lesion or the ulceration. So next, I am going to inspect for the edema or the on the lateral or the bilateral. Okay, so I observed that the legs are identical size and shape bilaterally and there is no swelling or atrophy. So next, I am going to palpate for the edema. Okay, so there is no edema present on the leg. So next, I am going to palpate your skin temperature. Okay, so I observe that your toes and feet and legs are equally warm. So next, I am going to palpate for the superficial inguinal lymph node. So okay, so non-tender or movable lymph nodes up into 1 centimeter are palpated. So next, ma'am, I am going to palpate for the femoral pulses. Okay, so ma'am, the femoral pulses are strong and equal bilaterally and it is normal. So now I'm going to auscultate for the femoral. So I'm going to use a stethoscope. And okay, so ma'am, there is no sound auscultated over your femoral arteries. So next, I'm going to palpate for the popliteal pulses. So, ma'am, I observed that there is not an unusual for the popliteal to be difficult or be impossible to detect, and yet for the circulations to be normal. So next, ma'am, I am going to palpate for the dorsalis pedis process. Okay, so the dorsalis pedis are bilaterally strong. So next, I am going to palpate for the posterior tibial pulses. So the posterior tibial pulse are strong bilaterally. So next, I am going to inspect for the varicosities and the thrombolytitis, ma'am. So So next, ma'am, I am going to perform a arterial insufficiency while you are in the supine position and by placing my hands under both of the your ankles. So I'm going to raise your legs at 30.48 centimeters above heart level, and I am going to ask you later to pump your feet up and down for 1 minute. So, okay, so I'm going to now, ma'am, can you do that position to observe? Okay. Okay, so now, ma'am. Okay, so ma'am, the feet pink is slightly pale in color in the leg skin with elevation. So while when you sit up and the dangles or legs, a pinkish color returns to the tips for the toes in 10 seconds or less. So the superficial veins on the top of the feet fill in 15 seconds or less. So next, ma'am. Also, the normal responses with the absent pulses suggest that the adequate collateral circulation has developed around the arterial occultation. So next, I am going to sanitize my hand. So now I am done washing my hands. So ma'am, thank you for your cooperation. Thank you. And now I am going to formulate a diagnosis. So a nursing diagnosis analyzes the patient's needs. First and foremost, we have to collect and analyze the data. We have also to observe the patient's symptoms. We have also to talk the patient and their loved ones about how they're feeling. We must evaluate the patient's response to their symptoms, distinguish between objective and the subjective data. We must also to identify the problem that your nursing diagnosis will be addressed. So here is the patient referral form. So the name of my patient is Miss Paulina Canto. The date of birth is on July 25, 2002, and her age is 27. Also her address and contact number and her contact name. Also her the patient's mother's name is Mrs. Pauline Acanto. Okay. So here for the reason for referral, so Miss Pauline was referred to Peripheral Vascular System assessment performed by me, Nurse Emmy, to evaluate and observe if there is any abnormalities or problems or condition that Miss Acanto experiencing. So asking some relevant question to elicit information and timely insight, the health record of Miss Acanto and can point out that some early symptoms or de-identify certain condition that may require early attention. So hence, the assigned nurse would be better understand about Miss Acanto overall evaluation. So here is the health summary of my patient. So my client said that she doesn't experience any pain or cramping on her legs. Also, my client said that she does not feel any pain in her legs. Also, my client said that she does feel any pain while walking for an hour, but it is relieved by rest, or she does not able to climb the stairs. Also, my client does not experiencing a heaviness, an aching sensation in her legs, aggravated by standing or sitting for long periods, like edema or any varicosities of her legs. Also, my client does not have any leg veins that are roped, like bulging or contorted. Also, my client does not have any swollen glands or lymph nodes. Here also there is diagnosis. Also, she has no previous problems with her circulation in her arms and her legs. Also, my client said that she didn't had any heart or blood vessel surgeries or treatment such as a coronary artery bypass grafting, repair of an aneurysm or vein stripping. Also, she said that her family does not have any history of DVT, diabetes, also a hypertension, coronary heart disease, or a elevated cholesterol or any levels. Also, the well diagnosis, my clients never smoke and drink any alcohol. Also, my client said that she does not she does exercise regularly or twice a week. Also, she said that she does not use a oral or a transdermal contraceptives. Also, my client said that she does experiment stress, especially in her school breaks. Also, my client said that she does not have a problems with her circulation or any affected by her ability to function. So also here. So next, the second part is to identify the related factors. So first, we have to find the source of the patient's problem. Next, to evaluate the patient's history and overall health. Also, third, we have to include the potential problems when determining the related factors. So here is the patient's mother, Mrs. Lisa Acanto. So good afternoon, ma'am. Okay, so ma'am, I am going to ask you a question. So ma'am, is it true that your family does not have a history of DVT diabetes or any hypertension like coronary heart disease or any elevated cholesterol?
Yes po.
Okay, true. So thank you, ma'am. That's all. Okay, so in third part in making diagnosis is making a clinical judgment. So first step is define the most appropriate nursing diagnosis. Second, we have to combine the related factors for the diagnosis. And third, we have to summarize the data. So here is the objective or the overall diagnosis of my patient. So I observed that my client arms are bilaterally symmetric with minimal variation in size and shape, and there are also no edema or prominent venous sputtering presented. Also, the colors are same bilaterally. Also, I observed that her skin is warm to the touch bilaterally from fingertips to upper arms. Also, her capillary beds refill color returns in 2 seconds, so it is normal. Also, the radial pulse is bilaterally strong 2+, and the artery walls have a resilient quality. Also, the ulnar pulse may not be detectable. Also, I observed that her brachial pulse have equal strength bilaterally. Also, my client epitracheal lymph nodes are not palpable, so is it normal? Also, the pink coloration returns to the palms within 3 to 5 seconds if the normal artery in my patient. Also, the pink coloration returns within 3 to 5 seconds if the radial artery of my patient. Also, I observed that her skin on her legs and appears on the dorsal surface of her toes. Also, the legs are free from lesion or the ulceration. Also, I observed that her legs are identical size and shape bilaterally and no swelling or a atrophy. Also, there is no edema presented on her legs. Also, my client's toes, feet, and legs are equally warm bilaterally. Also, her femoral pulses, strong, are equal bilaterally. So, here is the referred by healthcare provider. So, me, Amy Rose A. Dolo. Also, the signature and address are important. Okay? So, that's all for the assessment of the peripheral vascular system. Thank you.